Hello, welcome to the ASCP Spring Summit Back to Basics presentation for dry skin versus dehydrated skin. My name is Stacy Best-Nervis, and I am a brand educator for SkinScript Skincare. I am a licensed esthetician and have been practicing since 2018. I own my own skincare practice in Midtown Phoenix, and I specialize in customized treatments for barrier health repair, texture, and hyperpigmentation. Here at SkinScript, our mission is to provide great products and education so our estheticians prosper and succeed. Dry skin versus dehydrated skin. Let's dive into it. Today, we will discuss the characteristics of both and strengthen our skin analysis to better determine what our client's skin is showing in the treatment room. Dry skin is often used interchangeably to be described for dehydrated skin, but the two are quite different. Dry skin is a skin type. So think of your skin categories: sensitive skin, oily, normal, combination. Dry skin is going to be skin that has a loss of sebum and lipids. Remember, sebum is produced by the sebaceous glands, and our lipids are the fatty, waxy substance that makes up our skin cells. Dry skin can present in different ways. It may be flaky, possibly patchy in certain areas of the skin. Our clients can have some itchiness on the skin as well, specifically in those areas that might be a bit patchy. They might even have a tight sensation of their skin. They might find this after cleansing or even after using their skincare finishing products. Dry skin is often going to be textured, so you might see some raised bumps, maybe a bit of roughness in the skin. Here's a few images of dry skin. Here on the left, you'll notice the rough texture. You can see a little bit of flakiness. You can see the uneven texture of the skin, even some areas of congestion. On the upper cheek area, you can see it's a little irritated, even a little bit red. This would be a good example of someone with dry skin. On the left, this is showing some severe dryness, very flaky. It honestly looks a little bit like skin after a chemical peel, so a lot of that peeling and flakiness. And this could be seen in someone who has severe dry skin. You can even see the lips. The lips look a bit chapped as well. But certainly this can happen in parts of the face or all over. Now let's talk a bit about our dehydrated skin. Our dehydrated skin is a condition of the skin. This is often temporary and something that can be treated. This is due to loss of water within the skin. You can have dry skin and be dehydrated. Additionally, you can have oily skin and be dehydrated. So remember, dehydrated skin is not a skin type, it's a condition of the skin. You may see more sensitivity in dehydrated skin. When we think of the treatment room, maybe you're using an enzyme on the client or even just starting to cleanse, they might have heightened sensation just due to a compromised barrier, maybe even when using active skincare. You'll also see more prominent fine lines and wrinkles. Typically, this will be shown within the forehead. And the skin also appears to be dull. So what do we mean by dull? One, it looks like it is lacking hydration. You might see some uneven texture, and it also has an ashen look to the skin. Skin can become dehydrated due to overexfoliation, poor diet, and even a dry climate. Here we have an example of dehydrated skin. I love this image because this client has a different skin type. This client is showing acneic skin, so we can clearly see there are some closed and open comedones here, but you'll also see some dehydration lines. Those really fine lines that are right there on the forehead, showing that the skin is just lacking that water. It also has a little dull appearance as well as some tightness due to that acne and that lack of water on the skin. So looking at dry versus dehydrated skin, just to recap, remember our dry skin is a skin type. It is going to be lacking lipids and sebum. Dry skin has an underactive sebaceous gland. Remember, our sebum is coming from our sebaceous glands. So with dry skin, if we're already lacking it, it's showing those sebaceous glands are underactive and not operating optimally like they should. Someone with dry skin could possibly have an underactive thyroid or maybe some hormone imbalances that are also attributing to their dry skin. Our dehydrated skin is going to be a condition of the skin. Remember, this is temporary and can be treated, but this is because there is loss of water within the skin. The skin is really not going to be very supple. It's not going to feel hydrated. And it is caused by overexfoliation. This can be caused by your clients using just maybe not the best products on their skin, stripping cleansers, harsh skincare products. They could have a poor diet and those dry environmental conditions. For instance, maybe they're in a place where it's very warm and there's not a lot of humidity. This can also cause some dehydrated skin. Right in the middle here of this graphic, you'll see where if you have dry and dehydrated skin, how it can show up. The skin will be very tight, flaky, and sensitive, and you can see a few elements both in dry and dehydrated skin. Now let's talk about some treatment tips. So now we know dry skin versus dehydrated skin. What are each attributes there? Now, when it comes to our client and treating them, here are some things we need to gain a better understanding of our client's skin. We want to focus on our client consultation, our skin analysis, and then an assessment we can do in the analysis to let us know if we're really looking at some dehydrated skin or dry skin. All right, working with our client consultation. Now, this is a very important part of our treatment. This is something that is crucial and happens before our client even lays on the table. Here we want to gather as much information as possible about our client. We want to know, what do they do for work? What do they do for fun? Do they work outside, a busy restaurant? Are they in an office all day? What types of things are they exposed to that could be influencing the condition of their skin? We want to understand their skincare products and what they're currently using. I like my clients to provide all of the products that they're using, whether bringing it in during our consultation or taking a picture, and ask them, how often do they use these products? When was the last time they used the products? This will really give you a good understanding if there's maybe a product that they're overutilizing that could be attributing to the condition of their skin. We want to make sure to discuss all medications and supplements the clients are taking. This is also really critical because some medications and supplements can cause different issues such as dryness in the skin. Now, of course, we're not medical professionals. We don't want to stop anyone from taking their medications, but it's just good to get an understanding of things that they might need to help with their life, what could cause some dryness or dehydration. When we look over on the right-hand side here, we have a little chart. We want to know what they're working with, and are they working with aggressive products, utilizing those in their skincare. This will be a good way first to understand, are they dehydrating their skin and causing just more issues with that skin condition. As we know, dehydrated skin is a lack of water. So it's really important to understand what is our client's daily water intake. How much water are they actually drinking? On this chart, it's listing 1 a day. So this is showing 1 cup of water a day. So about 8 ounces. That's definitely not enough water that you need for a day. And if this is something that is consistent, that the client is not drinking enough water, again, it could be influencing the skin condition, specifically dehydrated skin. So when we are asking our clients about water, we really want to get a realistic understanding and look at what their water intake is. A lot of people carry around water jugs, tumblers. Ask them how often are they refilling it? How many ounces are it? If they're not drinking enough water, what other beverages are they drinking throughout the day that's helping them stay hydrated in a sense? Are they drinking coffee? Are they drinking a lot of tea? Are they drinking sodas? That's a good understanding to see where their hydration levels are and if they're lacking. Alcohol consumption is also critical here. Alcohol can be very dehydrating. So let's say it was a certain month and your client had a lot of happy hours, a lot of celebratory meals where alcohol was being consumed. This could be something that altered the state of their skin. So again, just little pieces to a bigger puzzle. We want to understand if a client smokes. Smoking is something also that causes dehydration in the skin. How much sun exposure they're getting also impacts the skin. And of course, are they moisturizing? This is really critical. As we talked about, dehydrated skin is a condition. So you can be an oily skin type and be dehydrated. So if your client comes in with an oily skin type that we see during our skin analysis, but because they're trying to avoid oil and they're not moisturizing, this could be increasing transepidermal water loss, where they're losing that moisture and water within the skin. Again, just pieces to the puzzle here to help understand your client's skin. During the consultation, it's important that we get your client to sign all consent forms, no exceptions here. We want to make sure that they understand the information that we're going over, as well as get prepared for the treatment down the line to help with their skin concern. So why do we do a professional skin analysis? Well, that's easy. We want to understand the client's skin, and we also want to know what treatment we should be doing on the client's skin. A skin analysis is giving us the ability to determine what direction we're taking for treatment. Let's say a client comes in and wants an aggressive treatment. This is where we're reviewing the skin and we can understand what the health of the skin is and if this is even a viable treatment option down the line for the client. We are the professionals, so we will be providing the best course of treatment for the client's issues. We're determining what products to use during the treatment. So this is where we're selecting our enzyme for exfoliation, what mask we're going to use as far as the finishing treatment mask. It's important here during our skin analysis that we're identifying the client's skin type, taking time to look at the skin, seeing if we're seeing any compromised barrier, visible pores, any uneven skin tone or texture. We're identifying all those conditions of the skin. We're also identifying Fitzpatrick type, which is also really important when it comes to our sun exposure and hyperpigmentation. And we're here to see what is the cause and effect of that skin condition. This is a great way to get some feedback from your client as far as what they're feeling on their skin. And we're able to just talk through what they're experiencing, what they're doing at home, and how that's showing up on their skin. This is a great way to recommend some products that can address those skin conditions that the client is experiencing. I always recommend to stick to maybe 1 to 3 products that relate to the skin concern and just some recommendations you can give them that they can use at home. This is a great way to educate your client about what they're experiencing, specifically dryness as a dry skin type and dehydration, and what products they can use at home. Very important to stress here that their home care is actually their homework. This is what is going to help improve the condition of their skin and get them having nice, healthy barrier. All right, now we're going to talk about a little assessment here. This will be part of your skin analysis that just helps you better understand, are we actually looking at dehydrated skin? It's important to feel the skin during the skin analysis. Does the skin feel textured? Is it rough? This might indicate some dryness. Are we seeing any visible pores, specifically at the T-zone, looking at the forehead, the nose, under the chin, in the middle section of the face? Are we seeing any visible pores? Are we feeling rough texture? This can let us know that their skin is a dry skin type. Now, if we are seeing some visible pores, especially in those areas, this can let us know the client might be more of a combination or oily skin type. Now, if the client's skin feels tight to you, or does it feel tight to the client? This is a great way when the client lays down on the treatment table, even before you start the cleanse, ask the client how their skin is feeling. If they're already letting you know that it's feeling okay, feels a little irritated, feels a little tight, once we cleanse and then go into skin analysis, we can follow up, ask again how their skin is feeling. This can let us know, especially if we're using hydrating cleansers, how the skin has really responded to that. And if it's still feeling tight, potentially we could be looking at some dehydrated skin here. Final tip here when we're doing our skin analysis is observing the client's forehead. This is really going to give you great indication of dehydrated skin. If you lightly pinch the skin on the forehead, just gather the skin together. We want to look at how the skin is responding. Is there a nice bounce back of the skin? That lets us know that we may be looking more at a dry skin type or another skin type. If we do that pinch and the skin is very slow to rebound and bounce back, that's an indication of dehydration. You'll notice that you'll see some more creases in the skin, some of those fine lines, a little more pronounced wrinkling just from that little pinch of the skin. Let us know that the client's skin is lacking water and is in a dehydrated state. So now we have all of this new information that we gathered from the client's consultation. We've gathered this from our skin analysis. So now we are ready to go into our treatment. So this is where we are now looking at our professional enzymes and masks. SkinScript offers 8 classic enzymes and 5 classic masks, and these are all formulated for all skin types and Fitzpatrick's. So it's great as you have a lot of different options to create a nice customized treatment to really help aid in all skin conditions, but specifically dry versus dehydrated skin. I have a couple of enzymes here that really target hydration that I want to talk through. Our first enzyme, the coconut papaya, which is in the top left-hand corner. This is a great enzyme for first-time clients. It's good for all skin types. It's pregnancy friendly, good for your sensitive or rosacea skin. It's also acid-free. And this is going to be rich in antioxidants that are fighting off those free radicals, nourishing the skin with coconut puree. It's smoothing the texture. And it also has papaya, which is high in vitamin C and beta carotene that's digesting and dissolving the dead skin cells. Additionally, the coconut papaya enzyme has great botanicals to help reduce inflammation and calm the skin. This is a great option, again, when you're just getting introduction to your client, but specifically focusing on dry or dehydrated skin, because it's really going to soothe and really help to boost up those hydration levels. In the middle, we have the pineapple enzyme. This is another great option. It's another non-acid. So again, it'll be great for your first-time clients, pregnancy friendly, all skin types, and Fitzpatrick's. This one is great for hydration. It also has bromelain, which is the digestive enzyme here from pineapple. And this is really going to help to digest and dissolve those dead skin cells, followed along with pineapple juice and L-ascorbic acid. So it's going to be full of vitamin C, really help to brighten the skin, helps with that collagen synthesis, so a little bit of firming. So this is going to be great for hydration as well as some firming and brightening for your clients. The third enzyme that we'll talk about today, which is in the top right-hand corner, is our lemon zest enzyme. This is actually the first enzyme that was created with the line. And this not only is an enzyme that helps with hydration, but it also targets hyperpigmentation. So this enzyme is going to be great for normal to dry skin types that are experiencing hyperpigmentation. We have lactic acid as well as glycolic acid that's really going to help to boost hydration, help with texture. And we've now added in some skin brighteners such as arbutin and kojic acid that really is going to help to fade some hyperpigmentation that could be impacting the skin. Now, because we have added some acids, this will not be pregnancy friendly, but a great option, again, for that hydration and pigmentation. At the bottom, we have our Skin Script mask. These are all formulated to target hydration concerns, and they're all going to be great based off your skin type. I want to first talk about our strawberry spearmint and our charcoal refining mask. These are wonderful masks that have kaolin clay, which traditionally will dry hard on the skin. Ours is formulated in a cream base, so they will not dry hard, but they do a great job for those skin types that are combination or oily, that are really looking for some oil control. That kaolin clay will really help to just draw out any impurities, any extra dirt and debris, excess sebum from the skin. But it's very nourishing with a lot of great benefits and ingredients that really help to nourish and hydrate the skin. Our goji berry yogurt mask is a wonderful hydration and firming mask full with yogurt extract that really helps to reduce inflammation. Our seaweed mask actually has the wakame extract in it. This is a great mask, especially if the skin is slightly irritated or sensitive. It's a gel-based mask. Really nice slip on the skin. You could even do a slight massage with it. Very hydrating for the skin. It also features some chamomile extract to really help to soothe the skin. And the last option we have is our Golden Honey Nourishing Mask. This is a wonderful mask with a peptide that really helps with rejuvenating the skin. It helps with that epidermal regeneration of the skin and also assists with evening the skin tone. Very, very nice. As you can see, just with these 3 enzymes that we talked about and our 5 classic masks, you can make a lot of great different treatments for your clients to really target that hydration and increasing moisture within the skin. So now that we have our treatments ready, our supportive retail products are things that your clients can use at home. Our pomegranate antioxidant cleanser is actually created for dry skin. This is an aloe, jojoba, and grapeseed base with full of antioxidants such as pomegranate. This is going to be a great way to brighten the skin, get a radiant glow, as well as increase that hydration within the skin. This is a creamy base cleanser that even works well as a first cleanse to help loosen up makeup or eye makeup that your clients might utilize. Our Cucumber Hydration Toner is an award-winning product. This is a great product. You can see it comes in a spray form, so you actually can just spray this throughout the day, but definitely you can use it as part of your toner. It does include hyaluronic acid, which really is going to help just to bring more hydration to the skin. This is a great toner to use before your serums and moisturizer because it actually helps to improve the absorption of your other products coming in. This is helping to rebalance those surface lipids. So remember when we talked about dry skin and that lacking lipids and sebum, your cucumber hydration really is helping to rebalance the skin. Now we get into some of my favorite parts. I love serums. So the Ageless Hydration Serum is actually one of my favorites. This one has hyaluronic acid, honey, aloe, just to name a couple, as well as it's filled with ceramides that is really going to help to bind moisture and help to attract more moisture and hydration within the skin. This serum can be used daily. It could be used night or day, or and day. You can use it a couple times a day. These work really well, especially together with that cucumber hydration, just to attract and lock in more moisture. We can't forget about our vitamin C. Vitamin C is going to be critical to helping with just that UV exposure, oxidative stress, helps to brighten, tighten the skin. We do have a vitamin C that is in a nourishing cream base. It's our citrus C. This creamy base is going to be very hydrating. It offers an oil-soluble form of vitamin C at 5%. So it's really going to give you just some great protection from that oxidative stress from UV rays. And it's also going to be very hydrating. Now, lastly, one thing that we need just to seal everything in, our Ageless Hydration Moisturizer. This is going to be good for normal to oily skin types. This one is very good for dehydrated skin. So if your client is combination oily but is very dehydrated, the Ageless Skin Moisturizer is going to be a light-based weight moisturizer that they can use. It's not going to be too heavy, but it's going to have some great ingredients such as the CoQ10 that's really going to provide intense hydration. So really helping for that dehydrated skin barrier. Our last one is our hydration moisturizer. This is our thickest moisturizer. A beautiful texture, shea butter, cocoa butter, rose hip, aloe, just a beautiful blend that really calms the skin, gives you a nice amount of hydration, and really helps too if your skin is feeling any inflammation. Great for those winter months when the skin might feel a little chapped and more dry. So as you can see, these are some great products that we have that your clients can use as part of their homework or their home care. Will really help to provide support if they have dry or dehydrated skin. We also are excited about our recently launched new products that your clients can utilize at home. We have our Revitalizing Cucumber Treatment. This is an at-home exfoliating treatment that your client can use 1 to 2 times a week. This is aiming at providing a lot of hydration, that antioxidant support. It is going to have that cucumber, a little bit of papain in there, really just to improve texture and hydration. And then we have a great hydrating mask, the Botanical Bloom Hydrating Mask that can be utilized. This is amazing. It has a superfloral complex that features rose, daisy extract, and orchid stem cells. All are going to be very rejuvenating, hydrating, and brightening. Beautiful. It even has a 3 hyaluronic acids included in that hydrating mask. So again, perfect for dry or dehydrated skin. These again are all great products that you'll see we have featured within the treatments or your clients can utilize at home just to support those different skin types. We welcome you to register for an account with SkinScript. You can just scan the QR code that's right here on the screen. We have many resources just to help you on your way to make you more successful that are all free and right at your fingertips once you get access to the account. We have free certification courses. We have a product knowledge e-learning there. So if you have any questions or want to know more about some of the products, we have a great comprehensive learning platform there for you. We even offer a chemical peel workshop that's available on our Learning Center. So many great goodies for you all. We also have online ordering, drop shipping, just again, great resources for you on your journey. We want to thank you so much for joining us today as we discussed dry skin versus dehydrated skin. We hope this has assisted you, and we hope you stay connected with us and have a wonderful day.